Thank you for joining the Red Clinic podcast. I'm Dr. Schwalen, expert psychologist in the treatment of eating disorders. And today I have a very special guest with me, Ms. Carrie Kirker, registered nurse in the field of eating disorders and currently working in residential treatment center with Center for Discovery. Carrie, do you mind just letting the audience know a little bit about you and your background?
Well, first of all, thank you for asking me to be on, Dr. Schwalen.
I'm so excited that you're here. Thank you for being here.
So my background as a nurse, I'm a registered nurse. I have been practicing for about 13 years now.
Okay.
I started out in a rehabilitation, and then I moved into visiting nursing. I took time off. I took about 4 years off, and I was a mom. And then I went into working with eating disorders at Center for Discovery in Dallas, Plano.
Okay. And so how do you think you got into eating disorder work?
Honestly, when I was looking for work, I didn't expect this at all. I was looking on Indeed and LinkedIn, and I was trying to look for an opportunity that was different. And when I was searching, Center for Discovery came up, and I saw, and I was kind of reading the description, and I was like, this is so unique. Like, what is this? I just decided to go with it, and I applied, and
it ended up being a really good fit.
Mm-hmm.
That's awesome. And I've heard from many professionals in our field that it kind of just like falls into your lap. You never planned on it, but then when you started doing the work, it's just something about it, right? That like keeps you wanting to keep doing it.
Yes. I mean, I found it to be very unique. It's a residential treatment center, so it's in a home, in a community, in a house. And when I first went up for the interview, I was just kind of like, this is wild. Like, I'm just going to be working in a house right now. And they embraced me and they welcomed me, and I got hired, and I knew nothing really about eating disorders, to be perfectly honest. I knew of them, I had heard of them, but I had never worked with them.
Mm-hmm. And then, so over the course of the last 4 years that you've been there, it's been 4, right? That's what you said?
I think we're coming up on 4.
Okay. Almost 4 years.
Yeah.
You feel like you're well equipped to work with eating disorders now, right?
I do feel well equipped. I feel like I was meant to work with it.
That's really cool.
Mm-hmm.
Well, I'm really glad that you're here. If you also don't mind just sharing a little bit about Center for Discovery. I mean, a few episodes ago, I had a professional on the show who was from Eating Recovery Center.
Mm-hmm.
You know, there's a lot of colleagues out there, and we refer to one another. We work together. You know, at the Red Clinic, we're all outpatient. At Center for Discovery, for example, you are at the residential level of care.
Mm-hmm.
So what does that even mean?
So Center for Discovery is allowing kids that are they could be coming from home, they could be coming from like partial hospitalization, or they could be coming from intensive outpatient care, a program. They are coming into a program that is a collaborative approach with doctors, psychiatrists, registered dietitian, nurses, and ED techs. They were previously counselors, but now they're ED techs. They will come and stay and live with us. So they'll be there for about anywhere from 4 weeks to 3 months is typically the longest stay that somebody has been there with us.
Okay. And you mentioned that the CFD residential house it's like a true house.
Mm-hmm.
And I've been there many times before because I was a previous clinical advisor to CFD, and it's a mansion.
Yes.
Right? It's
it
like
is.
no joke.
Yeah, it's not a hospital.
Beautiful mansion with like a tennis court in the backyard,
A
pool, beautiful bedrooms, this awesome, amazing kitchen, right? This almost like grand entrance when you walk in. I remember it because it was just, it's
There's
so
this
striking.
whole staircase that just spirals up.
And so, I mean, talk to our audience out there. You know, if somebody gets the eating disorder diagnosis and they have to take their child to a place like this, first of all, I mean, I can imagine that level of care, dropping your child off, right, and not really knowing what might be happening while they're there. How do you talk to patients about that? How do you help them make sense of it all?
If I'm being honest, when the kids come to the nurse, they typically come to us pretty early on first for their intake. I don't really go into nurse mode. I go into mom. I kind of remind them that it's okay that they don't want to be here. It's okay that you're nervous. It's okay that you're unfamiliar. It's okay that you don't know everybody that's here. Like, you're gonna be okay. The first 3 days are the hardest. It's okay to cry. It's okay to miss your mom and dad, but you're gonna get through this. And I just kind of wait. I take a period of time with them where I let them either speak to me, or I let them cry, or I let them know what's to come next.
Okay.
Sometimes it helps kids to know what to expect next. But my main goal when they first come is to make them feel safe, honestly, to make them feel comfortable.
And I mean, I think that's so important. Like you just said, you go into mom mode, but I think nurses and moms are just so naturally nurturing anyways. It's cool that you said that. And so you're talking about kids. So at the residential setting for Center for Discovery, what ages do you guys treat?
We treat between the ages of 8 to 18.
Okay, 8 to 18 years old. And what are some of the reasons why a patient would need the residential level of care?
A lot of times home life is challenging. It's too much. The patient is having too hard of a time, I guess. I don't really know how to put my finger on it. It's different for all of them. They're all coming from different backgrounds. A lot of them, the parents want them there and they don't want to be there. Or we have patients that come and they do want to be there and they do want to get the help that they know that they need. I don't know if that answered your question.
It does. And I mean, I'm going to add to that a little bit because as an outpatient psychologist who does assessments all the time, eating disorder assessments, I have to be very upfront, and I've talked about it many times on several episodes now, at the assessment if even outpatient is an appropriate level of care. And I've always said to my audience that if you're getting recommended to do anything higher than that in terms of like partial hospitalization, inpatient, or even residential, it's because there's something serious enough going on that indicates, you or your child need 24/7 care at that point. And with eating disorders, especially those characterized by malnutrition, like anorexia or even ARFID, atypical anorexia, bulimia, even all of those have very risky, behaviors associated with them and essentially put people's lives at risk. Mm-hmm. And when somebody gets the recommendation to go to residential, it's because of the health concerns, right?
Right.
But like you said, the first thing you said was, well, maybe the home environment is challenging. And usually when providers think about making the residential level of care referral, it's also because they're thinking about family dynamics. Mm-hmm. They understand that for whatever reason, the family dynamics are at a place where they're not currently helping recovery. They kind of all just may need a break from each other.
Yeah, that's true. There is. And I think a lot of the time, the approach with Center for Discovery is asking the kids to take responsibility for their eating disorder and learn how to work through it and process themselves, but with a collaborative team that's kind of backing them up. They certainly do pull in the parents, mm-hmm. and they meet with them and they educate them. I do believe that it takes everybody. It takes everybody to be a part of it.
Right. It's like it takes a village. It's such a mm-hmm. silly cliche saying, but it's so true with kids. And then we know with eating disorders, it's even more true. If a child could kick that eating disorder out the door all on their own, they would have done it by now, mm-hmm. right? It's a whole battle. It's a fight to get that thing to leave. It is. And so the team approach, right, is so important. And that's even happening at the residential level of care. Mm-hmm. So as a nurse, can you tell our audience a little bit about why is a nurse such a crucial part of that team approach?
A nurse plays multiple parts. So she's doing the assessment. So she's looking over your health and your wellness. And if you are properly taking care of yourself while you're in treatment, making sure your vital signs are taken care of, making sure you're staying hydrated, making sure that you're not having symptoms of your eating disorder that could cause you to be a risk of falling or injury or anything like that. Or if we have to assess to see if they actually need to be transferred to a hospital for a higher level of care because they're not managing it well in residential treatment. But it does go beyond that. When they meet with us, it is still like a one-on-one session that you have with them, that you're building this trust and you're building this rapport with them while they're there. And it's you're building a relationship. I care very much about making sure I make them feel safe. I enjoy getting to know them and challenging their thoughts, their thought process, or encouraging them to continue working through things or that they can do hard things. So for me, it's not just, oh, I did your assessment, I did your vital signs, be on your way. Like I want to be a part of their process towards recovery.
And I think that right there is so true for those in the eating disorder field. Like you said, it kind of came to you unexpectedly, but then there's something about it that you just love. And I think what you're talking about is that transformation. And I talk about that on this show all the time. Eating disorder patients go through a true transformation. When they achieve full recovery, it's amazing to see, right? That they realize their values apart from the eating disorder. They finally become who we all knew they could be, and even better. I mean, they're just like this amazing version of themselves.
It was in there all along. They just needed people to show them
exactly
that they can do it.
Yeah, that fight. We know that fight's in there, and we just have to help them get to that point where they're not fighting us as the team anymore. They're fighting their eating disorder. So one thing that you said that I really want to highlight for the audience out there is that, you are not just like this medical assessment person taking vitals and keeping track of them medically, but you also really enjoy and find that it's very important to challenge their thoughts, right? And I find this to be so true of all of us in this field, that if we're psychologists, if we're physicians, nurses, therapists, we are all working with that patient psychiatrically as well. Isn't that interesting?
It is interesting.
Did you ever think you would be ever doing that as a nurse?
No, I mean, honestly, when I was in nursing school, my instructor told me that I should go into mental health, and I was like, no, I don't think so. So
here you are.
Here I am.
You couldn't escape. So when the question that I always get from even my dietitians, I work with dietitians at the Red Clinic all the time, and they say, well, how far is too far? And we always have conversations about like staying in your lane. You're a dietitian, I'm the psychologist or whatever. But we know with eating disorders, everything is blurred. Like it's not just about their physical health. It's so much about their mental health. So how do you manage that in a residential setting when maybe patients need to have a deeper conversation than just what maybe you beyond your scope even, or how do you know when it's beyond your scope?
I think with being in the residential treatment center, it allows for more constant conversation, so you can really get to know your patient, your client, faster because they're there every single day. So you're able to kind of read them a little bit better, know where they're at, know what they need. I spend a lot of time. I also sometimes just let them know I'm there. Like, I don't always, I'm not saying like I push them. I let them know, like, if you need somebody to listen, I'm here. I do know that there's certain situations or things that are out of my scope of practice that I'll hear them, I'll talk to them, I'll reinforce what's important, and I'll tell them that they need to continue that in session with their therapist. And I follow up with them the next time so that they know, if they did or they didn't really talk about what they needed to be talking about. I mean, we're working with a lot of teenagers that being a teenager is kind of a disorder in of itself. So you're working with a lot.
Like a double whammy, right?
It is.
Yeah, absolutely.
And I've even found sometimes with the kids, they'll be totally different with me than when they go out into the milieu and when they're with their peers. And when I see that, I can also talk to them about that. Hey, you and I had this talk in here, but so it's very unique.
It's a cool setting.
Yeah.
You get to see them like in their element, right?
It is. We call it eating disorder summer camp sometimes.
Yeah.
They all don't want to be there at first, but then eventually they enjoy it. They
get something out of it.
They do. They do. I think everybody leaves gaining something from it.
Okay. So if you could talk to us about, that first day, maybe that somebody comes to residential. So they get the diagnosis, they get the seriousness of it. Somebody's referring them to that level of care. right? And they're super, super anxious. There's a bunch of unknowns. It's scary. You said that sometimes, you know, the first 3 days, like they're just doing nothing but adjusting. What do you say? What do you want the audience to know about even the journey you just alluded to? Like when they first get there, all they do is cry and they're scared. But then by the end of it, they're happy that they came. I mean, how does that even happen?
Because without resistance to something, without pushing through something, without coping with change, we can't grow. That's true for all of us. So these adolescents are being put in a situation where they might not necessarily feel like they're ready. They might not feel like they can do it, but they're being put in a safe environment that's going to encourage them, help them, and push them along and push them through it. And it's not about being perfect. Like I try to remind them, like, you could do great one day and you could fall back the next day. But remember what you're working towards. Remember that you have to keep going. So I feel like the kids all have a different journey, all of them. They all have a different approach to it when they come. Most of them, after the 3 days of initially being there, they're getting in the groove of things.
Okay, that sounds great. I mean, it takes like encouragement and support, but then not letting them give up.
Yeah.
I like to tell.
A lot of them want to give up on themselves.
Okay, and you just don't. You won't let them do it, and you don't give up on them.
Mm-mm.
I like to tell families all the time. You know, it feels really horrible when you get these diagnoses or when you have to go to higher levels of care, but in the end, for the most part, the majority of our clients are thanking us. They're appreciative. They're grateful. They're so glad that they went through it. And it's like what you said. I mean, you have to go through the discomfort in order to grow and change, in order to achieve even recovery, right?
Mm-hmm.
And we talk about that all the time on these shows, on this episode, on this podcast, sorry. And so I love that you're here talking about, because you keep saying like setting it up to be a safe place, a safe environment. I know a lot of times when parents especially are told that residential is what the recommendation is, their number one fear and hesitation is, I can't leave my kids somewhere. Who's taking care of them? Like, I can't do this to them. And so how do you help parents with that?
Well, unfortunately, with the past year being COVID, we don't have a lot of interaction with the parents over the past year. I don't have a lot of the face-to-face with the parents. Prior to this, a lot of my interaction with the parents would be when they would come for their visits, and they would be able to come and do in-person visits. So I got to have more talks with the parents about how they were doing, like how recovery was going for their child, more so than I had the opportunity to really prepare the parent for the process that their child was going into.
Okay.
I would say that would be more of the psychiatrist that was
In constant communication.
Yeah.
And I mean, I think that's the key. Like usually the question is, who's going to talk to me? How am I going to know what's going on with my kid? But you're not just dropping your kid off and never hearing anything again.
No. So the kids are able to call their parents. They are able to have Zoom chats, and we recently just resumed visits. So parents are able to come and spend time with their kids.
And do they have visitation every day?
They do.
Okay. So it's kind of like a hospital where they get to go see their child daily and check in on a regular basis.
Yes, and they're allowed to have phone calls. And it is the first 3 days, though, that they don't allow the kids to have a lot of interaction. They want them to kind of get used to being in.
It's that adjustment period.
Mm-hmm.
Okay. Well, I think that eases a lot of fears out there, because many times when parents hear residential, they think they're never going to get to see or talk to their kid again.
Right.
And, you know, it's really scary. I mean, I hear it all the time. I even heard it just yesterday with a parent who said, you know, if I do this, and I was actually talking to them about having their child sign over a medical power of attorney because their child was in their 20s. And they said, if I do this, is the state going to be able to, you know, hospitalize my child and medicate them against their will? And you know, there's just so much fear there. And the answers to all of that is no. You know, essentially you, mom, are going to be able to make those decisions for your child. That's the point of power of attorney when your child is over 18. But those thoughts go through parents' heads even for when they're minors.
Of course.
You know, if I send my kid to a residential facility, are they going to medicate my child? Are they going to drug my kid?
Right.
You know, does any of that happen?
I mean, those are all real fears, but we have to go through a process of, we have to get parent approval for everything. So anytime the psychiatrist recommends a new medication, they have to get parent approval before we will even give it.
Absolutely, right? So it's that informed consent. Without parental consent, we as providers are not even allowed to touch the child, right?
No.
Or do anything unless the parent has consented.
Correct.
And signed something. Right? That's just reassurance, because that question I get all the time, of just parents fearing that they're not going to have any control over what goes on with their child. All right. Well, thank you so much for joining us today. This was super helpful. I think what we did, we accomplished our goal of just kind of knocking down that barrier to what residential care is all about. It's a very real thing in the eating disorder treatment world. I have patients all the time who step down from residential level of care and finally find their way to me in outpatient. So thank you for being a partner out there in the community and treating eating disorders with me.
Thank you for having me.
Absolutely. I hope you come back.
I will.
Well, there you have it. That's the Red Clinic Podcast. Thank you.